So my name is Ramesh Singh and I am from Mechanical Engineering Department of IIT Bombay, and we are developing helmet patient interface for non-invasive ventilation for acute respiratory distress, and this is being done in collaboration with Thermex Global and in Excel, which makes CPAP machines. And why we need to do this is because we know that COVID has created a big havoc in the country, and almost 5% of the COVID infected people would require some sort of oxygen support, and almost 2% would require something called ventilation support. So what we need is, we need to have an effective way of oxygenation. Some of the studies have proven that if we use something like a helmet patient interface, the device which we have developed, it can actually improve the treatment outcome, and it can help the patients recover faster, and some of the lungs problem which lot of patients face can be assuaged, and the patients can recover faster and better. That has been proven in some studies. So what we do is, we actually give continuous air supply from these two, and the patient breathes, and the breathing out happens from this. And the breathing out is actually exhaled from here. There is a filtering mechanism which goes on, so this gets filtered. So what is discharged to the atmosphere is pathogen free air. And then we can also control oxygen. So we can give, depending upon the patient's requirement and his oxygen saturation levels, we can give it the FiO2, which is the oxygen content in the air, can be given from 21%, that is natural air, ambient air, and then 100%, which is pure oxygen. So there will be a CPAP machine like this, which will be used to control this oxygen content. And then we can also control the expiratory pressure depending upon the patient's requirement. So we can go from 5 centimeter of water column, some degree of positive pressure, to 20 centimeter of water column. And HPI can work with a CPAP device like this, or we can use an air compressor, something like this, which is there, or we can also use it from wall supply, which is there in the hospitals. So the hospital will have oxygen supply and air supply, that can also be used. And some of the key features is, it's a completely sealed mechanism. So if you see, it's completely sealed, although the patient's neck will be covered with the elastic material, which will completely seal the helmet, and ventilation asynchrony is not required here. So we have also done a lot of scientific analysis to showcase that the flow, which with the airflow, is very nice, so that there is no carbon dioxide accumulation here. So the patient actually feels that the carbon dioxide content is not very high, so that the rebreathing, you don't rebreathe your own air. So you actually get sufficient oxygen while breathing. So this is some of the key things about the system, and the system is expected to be very helpful in COVID and Corona. This is a very cheap replacement for patients who don't require invasive ventilation. And lot of patients actually require oxygenation. With some respiratory distress syndrome, this can be actually deployable in field, in smaller towns. So there is a lot of applicability and potential use for this kind of a system.
I am Dr. Ambarish Kaur from Department of Biosciences and Bioengineering. I have been working on developing various kinds of UV sterilization solution at IIT Bombay. So far we have developed a portable UV sterilization unit, a germicidal UV cabinet, and a wheeled sterilization unit. Portable UV sterilization unit and germicidal UV cabinet can be used for sterilizing small objects, whereas the wheeled sterilization unit is intended to sterilize a large area. We have given our germicidal UV cabinet and wheeled sterilization unit to our IIT hospital for sterilizing various kinds of objects which they use daily. We are in the process of doing technology transfer of these developed prototype to some industries, and we are also doing consultancy work for few industries for developing various kinds of UV sterilization solutions. So this is the portable sterilization unit. In addition, we have also received funding from WRCB at IIT Bombay for developing a robotic sterilization unit which can be used for sterilizing public transport system as well as hospitals.
I'm happy to share with you today 3 of our technologies for COVID which are in late stages. The first one is the Duraprot technology. This is an antiviral and antibacterial coating which can be applied to textiles, and it's made of environmentally friendly materials which are all safe, and these cross-link onto the fabric. So we get wash resistant functionality, and so this improves greatly the performance of textiles as well as of PPEs and masks. And we have a very simple process which we have scaled up and actually licensed to multiple industry partners.
This is coating emulsion mixing with antiviral and antibacterial agent. Soaking this uncoated mask in coating solution, and after 30 minutes we will get this coated mask.
And we are looking forward to deployment of this technology for widespread use where it improves the functionality of the cloth masks. And we are also actually going to work with self-help group women, empowering them to directly make this technology themselves. An advanced version of this is also underway, further improved functionality. The second technology is Picovrid. Now, Picovrid is both a nutraceutical as well as in higher doses an Ayurvedic formulation. It is based on spices, and the interesting thing is that the actives have very strong antiviral effects and have directly inactivated the SARS-CoV-2 virus in vitro. And the main aspect of the technology is that we have been able to improve the absorption of these actives which otherwise can limit their functionality. And the next steps for this is that we are planning to do a clinical trial to look at its efficacy along with our GMP manufacturing partners. And the third technology is a surfactant, pulmonary surfactant replacement, which acts on pneumonitis and the ARDS complications of severe COVID. The US and Indian patents have been granted for this technology, and this acts by directly reducing the cytokine storm and has given us excellent results in preclinical ARDS models. This has a very high safety profile and uses known actives. We are actually looking for permissions for regulatory approvals for trials for this technology too. All in all, we hope that these technologies can help make a difference in these difficult times. Thank you.